And one thing that I get asked a lot is, are people living with HIV at greater risk from COVID? Has there been any? I think there was some data from South Africa recently, Linda. Is that the case?
Yes, so Susan, I was actually going to say it's a little bit of evidence against tenofovir as well. So that study that you're referring to was conducted in looking at health records in Cape Town, a great number, many hundreds of thousands of health records, and then looking at our HIV population. And what they showed was what we're seeing around the world, is that COVID disease occurs in people who have other diseases, particularly diabetes is coming up very strongly, hypertension to an extent, older people with these comorbid conditions. HIV does cause an increased rate of death with COVID, but it's not large. It's a minimal amount compared to, say, diabetes or hypertension. What was interesting from our data is it didn't matter whether those people were virally suppressed or not, and you would imagine the people who are not virally suppressed may be less exposed to antivirals, and we didn't see a difference. Now, the good news is that we don't have that many people in the Western Cape who are not virally suppressed, who are HIV positive. So that may be a confounder, in that data. But yes, we saw up to twice as many people for age, when you adjusted for age, seem to have become sick and die of COVID.
Yeah.
And even in those individuals, comorbidities played a role. So I think, that's the story. So I think we were very worried at the beginning, particularly, I think Lucy will bear out, as we sort of watched this pandemic moving across the north. We were very anxious, in South and Eastern Africa about what it would mean for us. And, I think we're relieved it doesn't seem to have as much impact as what we had really worried about.
Has that been a concern for you and people that you work with, Lucy?
Yes, it has. And I was just thinking how mental health issues have skyrocketed as well. And I myself, I just had to start seeing someone, although this is not really affordable, since I'm not on health insurance. You find that it's an issue. And also I saw today that even with COVID, if you go to a hospital and you're suspected of having COVID, the health insurance companies jump at that facility, and they say they can't cater for that. Can you imagine? You think you're safe because you have health insurance, but then you're not. And the other issues that I saw that were really saddening was how we had to pay for our own quarantine. If you went on quarantine, you had to pay for it, and it's not cheap. And people have lost jobs, or people are not going to work if they're in quarantine, and they're expected to just cough out of nowhere $280. It's just a scary time for sure, because you're still not in the light. We can't say we are now at a place where we are feeling safe. Our country, the borders just opened. School has been postponed for the whole year of 2020. Everyone will have to go back to the class that they were in. Just different.
Oh, that's so awful. One study that concerned me, that I know it was quite a small one, but there was a study from King's College Hospital in London that seemed to suggest that Black people living with HIV had worse outcomes from COVID. Is that something that anyone's seen? Or Gus, can you talk about that study at all?
Well, I mean, in the UK, it's absolutely, completely the case that not just Black people, but also people of Asian background have been much more vulnerable to COVID. But I think that's for socioeconomic reasons. I don't think there's anything necessarily sort of about them physically that's different. I think it's much more that Black and ethnic minority people are much more likely to work in public service jobs. They're more likely to live in multi-occupancy housing. They're more likely to have to work when other people can do it from home. All sorts of things, all sorts of factors go into this, and this is a pattern that's seen worldwide. It's certainly been the case in the States, as you may know. And I was just reading a really interesting study from New York, which found really that the prevalence of antibodies in people was absolutely tied to the relative poverty and the crowdedness of the neighborhood. So I think it's all about that stuff.
Are we finding that the COVID?
Sorry.
Yeah, go ahead, Lucy.
Something has mentioned. There was an article from Cambridge. I don't remember it in full, but they were saying people with different blood types tend to be more affected. I don't know if those studies are happening or it was just an assumption. Like they were saying, people with O blood group are less likely to get COVID compared to people with blood A. Blood group type A. Oh my God, yeah, you get what I'm saying.
Linda or Laura?
Oh, I don't know about that. I know I'm Group O, but I don't know about any association. But just coming back to the point, and Linda talked about the Western Cape data. There was a very interim initial analysis of deaths in the UK presented at the British HIV Association conference last week. And there was also an association between higher risk of death, although again small and nowhere near as big as, for example, having a high blood pressure or diabetes. But it's a signal again that we need to explore, but the numbers are fairly small at the moment, so I wouldn't draw too much from it.
Okay, fantastic.
Yeah,
and I think,
not to belabor this point, but I think, Lucy, people are looking for all kinds of associations. So aside the blood group, I think vitamin D is another interesting one that is, I think still hasn't completely landed. I think the jury is still out there, but that's fascinating epidemiological association again, that countries where they fortify vitamin D are looking very different to countries where they don't. So, vitamin D is, for the infectious disease world, has been an interesting molecule for a long time. So, I think we still have a lot to learn, and we will.